Now let me introduce the speaker for the day, Mr. Arjun B S, who is a Ph.D. scholar at the Department of Electronic Systems Engineering at Indian Institute of Science, Bangalore. We have got the apt person for this talk, and with the utmost pleasure, I invite you to begin the session. The floor is all yours now. Arjun.
Okay, thank you. Hello everyone, welcome to the talk. So technically I'm more a hardware person who develop robotic arms for medical applications or biomedical applications, especially surgery. And we will discuss how machine learning can actually help the people who work in my field of development of robots as well as surgeons totally. So the usual approach of translating or converting manually operated robots or manually operated surgical tools into a robotic or automated surgical tools is actually what people have been working for a very long period of time. And with the advent of machine learning and neural networks, this has gone to a further next step. So this actually have significantly improved the way surgical robotics have been going on, or the development in the field of surgical robotics have been going on. So we will see the different applications of machine learning that is not limited to some surgical tools or during intraoperative procedures, but also preoperative as well as the other applications that we will come across during the presentation. So before starting on to what actually is a robotic guided surgery or something like that, I will quickly go through a surgical procedure known as minimally invasive surgery, where actually the importance of surgical robots comes to picture. Okay, so minimally invasive surgery have come into picture of surgical treatment of diseases maybe 20-30 years before, with the advent of technologies such as endoscopes as well as needle probes. Now, what happens during a minimally invasive surgery is the surgeons or create small incisions. The incisions might be in the scale of some 2 to 5 mm, depending on the procedure, compared to the conventional open surgeries. So you can see here on this slide. So previously the open surgeries would consist of a incision that would actually cut across. In this case, in this laparotomy, the incision will almost span throughout the length of the stomach, while a keyhole or minimally invasive surgery will only have incisions at specific points through which we insert the tools, say robotic tools or other minimally invasive tools. So this is the main difference. So what's the benefit of doing this? The main benefits being the extent of injury to the patient is less. That means obviously the healing process will be fast, the chances of infection will be low. So all these benefits are there. Okay, so minimally invasive surgery is what actually enables the use of robot assisted surgeries. Now, so a lot of examples are there. For example, the ablation catheters is one main example of minimally invasive surgery. So as you can see over here, this is the patient body. So a catheter or a minimally invasive catheter or a probe is actually introduced through the femoral vein, and it passes all the way through the heart. And in the heart, as you can see here, the regions that are to be ablated or treated can be accessed by the catheter that have been passed through the vein. So instead of an open heart surgery, a small opening over in the groin region is sufficient for the catheter to pass all the way through. So this actually reduces the complexity of the surgery. An open heart surgery would have been way more complex than the procedure. And the good thing about this kind of a minimally invasive surgery for or the cardiac ablation is that the patient can go home maybe in a couple of days, and the surgery lasts within or less than 30 minutes. So it's actually a drastic change that we are looking at now. So where actually the artificial intelligence comes into the picture. Okay, so we have discussed about minimally invasive surgery. However, the importance of AI actually comes before this procedure starts too. So we can actually categorize the importance of machine learning into, or the application of machine learning into 3 different parts: pre-operative surgical planning, or when we do MRI or CT scan or X-ray, something like that. At that point itself, the importance of machine learning starts. And then during intraoperative guidance, or that means during the process of surgery, we will use machine learning in order to help the surgeon. And finally, when it comes to the tools, so that's where the surgical robotics come into picture, which uses the help of machine learning. Okay, now we will start with the preoperative planning stage of use of machine learning. Okay, we can say that, okay, there are 4 different steps of using machine learning into preoperative imaging or preoperative planning. Okay, in the text I have shown text in red, which are the networks that, or the machine learning algorithms that have been commonly used for different applications. I will not be touching much into the algorithms as such, because they are very vast. However, I will just give a glimpse of different applications that have been used of machine learning for these cases. So first step of preoperative planning would be the classification. So what is classification? We will see on the next slide in a more pictorial representation. So it's basically during an MRI or CT, or a case like that, or a imaging method like that. Okay, you will in here we see a MRI of a human brain. So when we do the MRI, the due to, I mean, the patient approaches the doctor saying that, okay, I have a headache or something like that, and the doctor suggests the patient to undergo an MRI. So the MRI results come up, and as you can see where I have laser pointed, there could be a lesion that pops up in the MRI image. And conventionally, the radiologist will classify it as benign or malignant. Benign means it's a normal one. It's not very harmful to the patient, while a malignant one is actually a threat to the patient. So benign lesions can be treated with medicines without going for a surgery or something, while malignant has to be treated via surgery. So such a classification have been done by radiologists usually. However, if we since radiologists are hard to come by, as well as the process is prone to error, it's all machine learning have been used to classify if the lesion is benign or malignant. So this is one application, that is the classification. Now the second application being the detection. Now that the doctor or the machine learning algorithm has classified the MRI image obtained as a normal or cancerous or benign or malignant lesion, then we go forwards to detection. So detection is where we actually locate the tumor, okay, based on the image, and okay, this is the region to be removed, something like that. Okay, so the region will be demarcated as, okay, as you can see on the right extreme. So this will be the region that is to be removed. So this is the detection. So after we classify it to be malignant, we detect the region. So for this applications too, CNNs and other neural networks have been used. So the next step is to do segmentation. So detection is more like a large scale process, while next we have to go towards further refined process, so that the surgery can be very accurate, and we can remove only the malignant region while preserving the normal regions of brain. So I am telling an example of brain where the criticality of tissues is paramount. So it's paramount for every case, but brain, since it will affect the functional behavior of the patients, it's extremely important. Now you can see here or in an image. Okay, so this region, the colored region over here, is the segmented image of the region shown on the left. So this entire region might have been detected in the detection stage, and further using machine learning algorithms, this region, the colored region, have been categorized into edema, advanced tumor, non-advancing tumor, and necrotic tumor core. So the red region as well as the yellow region will certainly be removed by the surgeon after getting this kind of a data, and the edema may or may not be removed based on the surgeon's discretion. So actually this significantly improves the way doctors do the surgery. So this is one major application of machine learning. And now coming back to the last step of using of machine learning for preoperative planning is registration. So what actually is registration? Now consider this, MRI or CT actually gives us sections of the brain. So it's like layer by layer images. And however, while trying to make a 3D model of the brain, or during the surgical procedure, actually the doctors would like to have a visualization of the 3D image of the brain or heart or any other organ. So in that case, these individual layers of scans has to be stitched together to form a 3D model. So this is especially valid in case of heart, as the heart actually pumps and the shape actually changes continuously as the heart beats. So in that case, this registration actually is important. So registration basically means, say consider these two are two different layers. The one shown on the green and the one shown during the red are two different layers, and they are actually disoriented. Okay, this is an extreme example, but this could be different. This has different application. I will show it further down the line. So as you can see, these two images are not aligned, but using machine learning algorithms, we will be able to align them together like this as shown on the right side. So actually the stacking becomes easier. So for this, the machine learning algorithm identifies different patterns on different features, and based on that the alignment happens. So this is what registration means. Okay, so by this is the main application of machine learning in preoperative planning. So once classification, detection, then segmentation and registration is done, the surgeons have got some information that can be used for planning the surgery. And the next step will be to start the surgery or do the surgery. So this is why it's called preoperative planning stage. Now the next step will be to do the interoperative guidance. Okay, so for this too, machine learning have been used. However, the applications have been limited so far. It's not very popularly used. There are a few cases where machine learning assists surgery, but it's a totally automated surgery is still under study stages. Okay, so here when it comes to interoperative guidance, the first application is the 3D shape instantization. Okay, so in this case what happens is, as we already said, we have preoperative imaging, and we have got we have segmented the area so we can target exactly. However, during the surgery too, in case the patient moves, or after the imaging the patient was moved from the imaging machine to the operating table, there could have been changes in the body. So in that case we actually need imaging along with the surgery for which we usually use ultrasound or X-rays or something like that. So in that case, we need 3D reconstruction of the patient's organ of interest real time along with or during the surgery itself. So this is more computation intensive, as the reconstruction should be almost real time, so that the surgeon can minimize the time of surgical procedure, thereby saving the patient's life. So I will show an example for that. As you can see, this is a reconstruction of a heart valve. So as you can see, these are different slices of the human heart, and finally these slices will be stitched together using the registration as procedure that we have already discussed, and finally a 3D model of heart will be developed. So the surgeon will be able to use this model to actually carry out the surgery. Okay, I will come to this next. Then we come to endoscopic navigation as well as instrument segmentation and tracking. So what actually is endoscopic navigation? So you might have heard of endoscopy, the procedure in which a tube will be introduced through the mouth or nasal passage in order to have access to the stomach or something. This is especially used for treatment of ulcers as well as cancers, in order to get a visualization of what actually happens inside the stomach. Okay, so one example could be, as you can see, during an endoscopy, the endoscopic tool or the endoscope is actually passed through the mouth and it reaches to the stomach. And the endoscope, at the tip of the endoscope, there will be a camera as well as a light source, which will be used to image the inside of the stomach wall. So which can see if there is cancer or there is ulcers developed on the surface of the stomach. Similarly, there is laparoscopy, where holes are provided on the belly, so that tools will be introduced in order to do different surgical procedures like removal of fibroid or something like that. And you must have also heard about angioplasty, where we introduce a catheter through the vein, and to remove the clot or to open up a vein that have been blocked by fat or some other contents. Okay, so this is the usual procedure for endoscopy. So this is actually being carried out by human beings itself. You can see here I have a catheter with me. Okay, so this is a catheter that is used for electrophysiology or for ablation application. So this catheter tube will be introduced through the groin area, which will pass through the vein to the heart. Okay, so this is actually manually operated, as you can see in my hand. Now you can see the tip of the catheter will actually bend as I move the catheter handle. So this catheter is actually manually operated. Okay, so you can see the tip of the catheter being moving. Okay, so this is one manual application of minimally invasive surgery. However, using machine learning, these processes have been automated. So it increases the accuracy, at the same time reducing the time taken for the surgery. So it's actually a great improvement to the current scenario. Okay. Then finally, we also recently look forward for augmented reality, so that the doctors or the surgeons can be trained, as well as during the intraoperative procedure itself, we can actually visualize the organ better or the surgical process better. So augmented reality is another fruit of machine learning for intraoperative procedures. Now, so finally we move on to robot assisted surgery, where robots have been used extensively for surgery. And this figure is a Da Vinci robot, which is developed by a company named as Da Vinci, which passed FDA clearance in 2000. So they have done extensive clinical trials, and this is one of the leading robotic arms or robot that have been used for surgical applications. As you can see here, the in this case, actually the doctor will operate the robot, and he can actually see a 3D visualization of the organ that he's treating. And on the right side, you can see, based on the input given by the doctor, the robot actually does the surgery here. Now, the main thing to understand is the doctor is controlling the robot, and the machine learning part comes to the point where the visualization that doctor sees over here is what actually the machine learning part. So it helps the doctor understand the depth where the probes are, or the or get the 3D idea of how the organ is, or where actually the tools are, or the interaction of tool with the organ or tissues. That's where the machine learning comes into picture. Okay. Now I am showing you a video. So this is a manual suturing process that you might have seen if you have a wound or something, and you go to the hospital, and this is a common procedure that you might have experienced. So the doctor will tie knots, and we call it stitching or something. Okay, so this is a knotting procedure. So this is a very common procedure, and here the demonstration involves showing a suturing operation from outside the body. So this kind of sutures can also happen within the body. So this is one of the most common as well as extensively used surgical procedure, because as layers of skin or tissues are cut open by the surgeon, the number of suturing layers will also be more. So this is one of the time consuming as well as repetitive process that is being involved in a minimally invasive surgery. Okay, now as you can see here, this is the Da Vinci robot that will be doing a similar operation on a grape. So as you can see here, you can see that the grape peel, which is actually very delicate, the robot actually very seamlessly takes that grape peel and does the same suturing operation that you have seen that is being done in a manual by a manual person, right? So you could basically see that a robot was able to actually very efficiently replicate what a doctor would have been doing, and so it can actually increase the efficiency, reduce the time. So all these benefits actually can be created by using machine learning. Okay, so this is the basic theme that I wanted to discuss. I guess that will be the end of the session. I hope it was useful. Thank you.
Thank you, sir, for the session, and it's time for us to discuss the doubts, if there's any. So, the viewers, you can ask your doubts in the live chat section now. So, we'll wait for a couple more minutes just to see if any doubts pop up. Okay, we have got one doubt. The doubt is from Emmanuel Manu. Sir, what about the machine learning in continuum robots in surgery?
Yeah. So continuum robots are one of the, even the robotic arm that, the Da Vinci have shown, as you have seen, the suturing of the grape. So it also actually consists of multiple degrees of freedom. So that's also one application. Okay. So there is significant use of machine learning for continuum robotics too. You will find enough resources online too. So it's machine learning is there actually for inverse kinematics and other things that can be done dynamically.
Okay, so the next question is from Kudian Sikurin. What are the most used machine learning libraries that are used in surgical robots? You can.
I'm not very confident to give you an answer on that. In one of the slides, I have given a reference. You might refer to that. It's a good paper that gives you better idea about that. I will show the slide. Yeah, so artificial intelligence is the surgery. This paper can be referred. It actually discusses a lot of algorithms or libraries that have been used for this application. You may have referred to that. Thank you.
Okay. So any more questions? If there are any, you can ask in the live chat section. So I believe there's no more queries left on your side to the viewers, and we are approaching to the end of this very wonderful session led by Mr. Arjun B S. And I take this opportunity to thank you on behalf of the Insights in 20 team and the IEEE RAS Chapter IEEE Kerala Section for your sincere efforts and for spending your valuable time with us during this session. And as a small token of our gratitude and love, we would like to present you with a token of our love. It's a virtual memento from our side. Hope you loved it.
Thank you. Thank you.
And thanks to all the viewers. Also note that the top of this series of talks, the last one takes place tomorrow on the topic Synergy of Human-Robot Interaction and Telepresence at 5 p.m. IST. And please do fill in the feedback form to receive your certificate for the session. Please find the same in the live chat section. So thank you all. And thank you, sir, for joining us.
Okay. Thank you. Bye. Bye.
Thank you.